And I must say, your work is probably more important today than it has been for a number of years. And that is because many of the advances that we have made, many of the programs that have helped to fill in the gaps are under attack. I think we all believe that the measure of any society is how we treat our children, and that every child deserves the chance to live up to his or her God-given potential. That should be one of the tests of who we are as Americans. So we've made progress. I'm proud of that. But still, more than 31 million children live at or near poverty in our country. It's not someone else's problem. It's not someone else's children. It's America's problem, because these are America's children. And at a time when we are closer than ever to realizing the promise of universal health care, there are still too many children who are left out and left behind, and too many people in positions of power who want to send us backwards. And we cannot stand idly or quietly by while they are doing that. You know, instead of working together to lift children and families out of poverty and give them a fighting shot in life, this administration and Republicans in Congress are mounting an onslaught against the needs of children and people with disabilities, women and seniors. And just this morning, the administration released a budget that would slash funding for Medicare, funding for the Children's Health Insurance Program. After all, children make up half of Medicaid enrollees. 45 billion children are covered by Medicaid and the Children's Health Insurance Program. And that's just the beginning. This budget also takes aim at everything from medical research and disease prevention to food stamps and essential nutritional assistance to programs that provide vital aid for children with severe disabilities. And to top it all off, the budget dresses up devastating cuts to the Children's Health Insurance Program by calling on Congress to extend CHIP for 2 years while slashing federal investments in the program and shifting the burden onto states that cannot or will not pay for it. So this means that many of the 93% of children in America who now have access to health insurance, public or private, will be at risk of losing it. And that's not just something that hurts families' pocketbooks. It hurts the well-being of children. It has implications for their futures. The president's budget cuts $1.7 trillion in programs that help the most vulnerable Americans. Now, this is more than just a list of programs and line items in a budget. It is a tangible representation of values. What kind of values would drive someone to cut health care for low-income kids and families in order to make room for massive tax cuts for the wealthiest among us? This budget, along with the relentless attempts to repeal the Affordable Care Act, shows an unimaginable level of cruelty and lack of imagination and disdain for the struggles of millions of Americans, including millions of children, every single day. None of us can remain silent in the face of these attacks. It's time to send a resounding message that we will not stand for this attack on the most vulnerable among us. You know,